Influenza is the popular name for a short-lasting fever associated with acute respiratory infection that is caused by influenza viruses. There are three types of influenza viruses: type A, type B and type C. Type A and B are separate genera, whereas because of some morphological and antigenic differences, while influenza type C has been accorded provisionally a separate genus status. Both types can cause mild to severe illness in all age groups. While influenza A viruses infect humans and other animals, influenza B viruses affects only humans. There are proteins within influenza type A which can change, or mutate, over time. Because these proteins can change, people can get influenza infections multiple times over their lifetime. The transmission of influenza viruses. How does influenza spread? Well, influenza is spread mainly through the air from respiratory droplets made when an infected person talks, coughs, or sneezes. Influenza may also be spread by touching a surface that has respiratory droplets with influenza viruses and then touching the nose, mouth, or possibly eyes. The influenza viruses enter through the respiratory tract, where these may be inactivated by the immunoglobulin A antibody produced in response to earlier infections with influenza viruses. If it does not occur, inflammation of upper respiratory tract results. Due to this infection, necrosis and widespread desquamation of the respiratory epithelium results. Lower respiratory tract is rarely involved. Influenza viruses lower the resistance of the respiratory tract, thus permitting the bacterial infections to supervene. So, how long does it take to develop symptoms of influenza after being exposed? The incubation period of influenza is usually 2 days but can range from 1 to 4 days. What are the symptoms of influenza? Typical influenza disease is characterized by sudden onset of fever, aching muscles, sore throat, and non-productive cough. Additional symptoms may include runny nose, headache, a burning sensation in the chest, and eye pain and sensitivity to light. Typical influenza disease does not occur in every infected person. Someone who has been previously exposed to similar virus strains either through natural infection or having a vaccination is less likely to develop serious clinical illness. Not everyone with influenza illness has a fever, especially older adults. Some people may also have nausea, vomiting, or diarrhea. These symptoms are more often seen in children. In the absence of complications, patient may recover fully in 7 to 10 days, but some people may experience weakness for a longer time. There are complications that may result, especially in children. Complications of influenza in respiratory system include bronchitis, bronchiolitis, pneumonia and secondary infection with staphylococcus and pneumococcus. In cardiovascular system, complications occurring, there is nonspecific electrocardiogram or known as ECG changes. Cardiomyositis. Cardiomyositis is the inflammation of the heart muscles. In central nervous system there is Reye's syndrome. Although many people think of influenza as just a common cold, it is really a specific and serious respiratory infection that can result in hospitalization and death. Rates of infection from seasonal influenza are highest among children. The risks for influenza-related complications, hospitalizations, and deaths are highest among adults ages 65 years and older, children younger than 5 years, pregnant women, and people of any age who have medical conditions that place them at increased risk for complications from influenza. Chronic conditions may increase the risk of influenza complications. Chronic conditions like asthma and other lung diseases, diabetes, heart disease, nervous system diseases, metabolic disorders, problems with an airway, and kidney, liver, or blood disease increases the risk of influenza complications. Diagnosis and treatment of influenza. The best way to prevent influenza is with annual influenza vaccination. 2 doses, given by intramuscular route, efficacy is about 70 to 90%, which lasts for 6 to 12 months. Single dose is administered by intramuscular or subcutaneous route and protectivity is about 50 to 80%, while immunity lasts for 6 to 12 months. Annual Annual inactivated influenza vaccination is recommended for high-risk groups such as children, older age, underlying chronic lung, cardiac, renal, hepatic, and central nervous system conditions, people with low immunity such as HIV patients and pregnancy. One thing to note is, it's contraindicated to people who have allergy to eggs or have history of hypersensitivity to previous dose. There are influenza vaccine side effects though, they do not last long. They include a sore arm where the injection was given, a slightly raised temperature, and aching muscles. Medications for influenza. There are 4 influenza antiviral drugs recommended for use in selected patients. Oseltamivir and inhaled zanamivir can be used for treatment or prevention. Oral baloxavir and intravenous peramivir are recommended only for treatment. All 4 provide protection against both type A and B influenza viruses. 2 other antiviral medications, amantadine and rimantadine, which have activity only against influenza type A viruses, are not recommended for use because of high levels of resistance among circulating influenza type A viruses. Use of antiviral medications can reduce the severity and length of influenza illness. People with severe illness and people at increased risk of severe illness should be treated with influenza antiviral medications when influenza is suspected. Some steps that may help prevent the spread of respiratory illnesses, like influenza, which include: wash your hands often with soap and water, especially after you cough or sneeze. If you are not near water, use an alcohol-based hand sanitizer. And, if you get influenza, stay home from work or school for at least 24 hours after the fever has ended. If you are sick, don't go near other people to avoid infecting them. The next one, cover your nose and mouth with your sleeve or a tissue when you cough or sneeze and throw the tissue away after you use it and then wash your hands. Also, you need to stay away as much as you can from people who are sick, note this. And lastly, try not to touch your eyes, nose, or mouth, because viruses often spread through this way.